One of the questions that we frequently get is, why does my leg feel different or feel like it's a different length after my joint replacement surgery? We usually get that question more after hip replacement surgery, although sometimes people ask us after their total knee as well. One of the things is you can actually have your hip made longer by hip replacement surgery. That is certainly something that happens, and it's always our goal to try to make your legs the same length, although it's not really always number one goal. We want the components to be in and stable. We don't want your hip to be popping out of socket. We want the parts to be stable within the bone. But there are a lot of other things that can play into that. One of the things can be that if you have any kind of back arthritis and it's causing any curvature or scoliosis in your spine, that can actually cause your pelvis to be tilted one way or the other. And that tilting of your pelvis makes your legs feel like they're different lengths, whereas if we actually measure the length of your leg, it would be the same. The other common reason that we have is in people that have had both hips replaced and you fix the first one. Usually people, they kind of walk sort of hunched over because it hurts them to try to put their hips out straight. So when we do the surgery, and it makes it so that the now new or good hip can come out straight again, the other one still can't come out straight because that one's still so arthritic. And when they eventually get that second one replaced, we tend to even them up. If you do end up having a slight leg length difference, a lot of times we treat that with just a little shoe lift or something like that. But most people, their brain adjusts to the fact that they might have a little bit of a difference one side to the other.
I tell my patients the feeling of leg length discrepancy tends to fade away as you get further away from surgery.
Right.
Oftentimes it's 50% better by 6 weeks and mostly better by 3 months. And if we're still feeling it at 3 months, I'll say, well, let's take an x-ray and measure it.
Another question is, when can I drive? Definitely don't drive while you're taking narcotics. And then I want to make sure that you can move that leg quickly and that your pain is well controlled so that you can respond and slam on the brakes if you need to. There's other times that I'll look at you in the clinic and I say, you know what, we need a little bit more work and you need to go see your physical therapist. And when your physical therapist feels that you're strong enough and your reaction time is back to close to normal, then you can resume driving. Another thing to consider is, are you able on your own to get in and out of your vehicle in a safe manner without hurting yourself?
Do you guys have any differences for people that are commercial drivers or driving for their employment?
So heavy equipment, specifically 18-wheelers on the highway, I tell them it's a minimum 6 weeks. It's patient dependent though.
Yeah, it really is. And you know, if they're having to climb up into a cab or something like that, it may be even as long as 3 months, because I say the same thing to my patients that do heavy work or construction work, you know, where they're going to be on ladders and scaffolds. So if you have a commercial driver's license and you're driving a semi and you're flipping tarps and you're doing this and that and the other, 6 weeks may not be long enough.
And it can in that unusual patient, but often it's longer. Yeah.
Another common question we get is, when am I fully healed? That's a pretty difficult question to answer because fully healed means different things to a lot of different people.
Right.
When I get that question from my patients, one of the first things I try to do is see what they mean by fully healed. Typically, I break it up into individual aspects of their recovery. And one of the first things I talk about is the incision healing and kind of acute surgical pain. And I typically expect that to be mostly better within the first 2 to 4 weeks from surgery. But a lot of times, patients also want to know, when can I get back to sports activities or other physical activities that they want to do? And for higher demand kinds of activities, it could be 3 to 6 months until the joint replacement is really allowing you to do that. Another question I get is, how long will my leg be swollen, or my knee feels warm? And I expect there to be those symptoms that can last sometimes 9 to 12 months following the surgery.
It takes a year to get over a major operation, and I think that's true whether you have your hip replaced, your knee replaced, your gallbladder out, whatever it is. But some things I recommend that they never do again. Like if they say, well, I want to go back to running marathons, my answer is, this is an artificial joint that should last you for the rest of your life. You don't want to be doing that kind of high impact thing on your artificial hip or knee because you'll wreck it and wear it out. The kind of last thought that I have about it is, to remind them that just because they've had their joint replaced, it doesn't mean that they'll never have an ache or pain in that joint. They can still strain the ligaments, they can still pull a muscle, they can still twist it or tweak it or fall down and harm it, and it doesn't necessarily equal to harm to the part. The other thing is that something that's close by can also give them symptoms. So we see people with hip arthritis, but they also have back arthritis. So we fix their hip, but their pain now is coming from their back and it's not from their hip anymore. So.
And another common question that I will get is, how long will I have precautions after my joint replacement? So precautions can include things such as lifting and carrying, weight bearing, using assistive devices, or even positions you could put your extremities in. With hip replacements, sometimes we'll have precautions in terms of which positions we don't want you to put that hip in. And after a hip replacement surgery, whether it's done an anterior or posterior, the restrictions typically only last about 6 weeks.
Same thing true with knee replacement surgery. Kind of similar questions, what can I do? And we usually tell them to avoid high impact activities or really twisting or pivoting activities. But in the early rehab period, we focus on doing a couple of things. One is getting your knee straight and one is getting your knee bent. Getting your knee straight is actually just as important, if not more important. And so we ask people not to rest pillows and ice bags and things like that underneath their knee, even though it feels better, but then your knee will start to get stuck in a slightly bent position.
And then on shoulder replacements, there's 2 different types of shoulders. It's important to know: a reverse shoulder replacement and an anatomic shoulder replacement. Both of those require entry to the shoulder through the front. And so we limit patients to external rotation to the neutral position, meaning straight out from your body, for 6 weeks. The second thing is, with a reverse total shoulder arthroplasty, we do all recommend a permanent lifting restriction with that arm. Say it was my right arm. With that arm, you cannot pick up more than 20 to 30 pounds, basically for a lifetime, and that's because of the mechanics of that type of joint replacement. So you completely understand, you could pick up something with both hands up to about 60 pounds then, if you're picking it up, even each arm holding about 30 pounds. And then your surgeon may have a different preference on the anatomic total shoulder replacement. So please speak with your surgeon, and a lot of that comes down to your overall unique condition, your bone quality. So please ask your surgeon and go by their expert opinion, specialized to you.
Another common question we get is, how do I manage my joint replacement for life? A lot of times that question is referring to specific things such as dental work. One thing we get asked a lot is, do I need my antibiotics before a dental procedure? For routine cleanings, we are not recommending taking prophylactic antibiotics anymore. But for invasive dental procedures where there's going to be work on the teeth and the gums, we are recommending that you take those antibiotics before you go in.
For example, root canal, dental implant, gum surgery.
Deep cleaning.
Deep cleaning.
Yeah. Those kinds of things. And if you go to the dentist and you haven't been for several years, then yes, it's probably advisable to do that. For lifetime things like how often do I need to come back ever, or, kind of what's your protocol. I think most of us see patients back fairly regularly for the first year to get surveillance x-rays and make sure that this mechanical joint that's made out of metal and plastic is still functioning the way it's supposed to, that you're not getting problems with wear or anything like that.
It's like a lot of things. It's patient dependent.
It's very patient dependent.
It's somewhat age dependent. The younger population, we're seeing problems, it seems like more common, that we're replacing a 45-year-old's hip.
Right.
They're going to have higher demands, probably put that hip through more cycles than a 75-year-old would. Right. So I tend to watch them closer. Another frequent question is, what if I get an infection somewhere else in my body? Is my joint going to get infected? You don't have to just run to the emergency department, the walk-in clinic, your primary care doctor for every little illness that you have. For example, if you cut your finger, normal wound care, watch it. If you get any signs or symptoms that you feel might be an infection, have your doctor look at it. and don't let things get out of hand.
We here at Orthopedic Associates, we thank you for entrusting us to this very important decision, this journey that you make from the time you come to see us and come to see us with the problem that you're having all the way up to the point that you end up having surgery and you go through the post-operative period. We look forward to continuing to provide excellent care for you, and we are happy to answer questions either in person or by phone for any questions or concerns that you might have.